asepsis and infection control. Now let me tell you something. This right here is not something you want to play with for any exam, especially in NCLEX. We are security guards as nurses, okay? One of our main things that we are doing is protecting our clients from infection as much as possible. Now, you do need to know the components of the infection cycle. You should have known about this since one of your science classes, but you do need to know this again because it will come again. With regards to the infectious cycle, yes ma'am.
I'm sorry, which PowerPoint?
Chapter 25.
Okay, sorry.
No problem. Okay? Now, parts of the infection cycle includes the infection, okay, the agent. You do need to know the pathogen or the agent or the infectious agent that you are dealing with regards to this client. Francesca, why should I, as a registered nurse, care about whether this client has a bacteria, a fungi, a virus, a protozoan or source? Why should I care? That's one, but why should I care? What's another reason? Anton?
You know how to treat it, they get treated differently.
Say it again.
They get treated differently, you know how to do it.
Boy, looky here. You just don't know that you are onto something. So can you elaborate a little bit more in terms of treatment? Are you able? Let me see.
Bacteria, well, a virus you can't treat the same as a bacteria.
What? What? Say it again, because you was having me worried earlier today, but boy, look at your comeback. Say it again.
You can't treat a bacteria the same as a virus.
Okay. Guys, do not play with me. When we get to that portion, you do need to know if the pathogen that the client is infected with is a bacteria, is a virus, is it a fungi or source, because if the patient has a flu is what? A virus. And amoxicillin. Do we know what amoxicillin is? Antibacterial is a antibacterial. Can we treat influenza with amoxicillin? No. Because what's going to happen? Nothing. And the patient might even risk developing a super infection too. So you might even cause more harm to the client. Yeah, buddy. Okay, don't play with me. Anton, you just don't know how you made my day with that correct response. That's one aspect. Then you have the reservoir. Reservoir is basically where they live. Reservoir could be the client themselves, or a human being, or animal, or a doorknob, or whatever. Where does the pathogen reside? You have the portal of exit, which is basically where does it escape from, or how does it escape? And we need to know that because, especially when it comes to infection control, we need to know which best way that this pathogen tries to escape, so we control how it's spreading. Then we have the means of transmission. How do they ride? How do they get about? Do they go about in a Bugatti? Do they drive a Toyota? What? Do they have to go from airborne? Do they have to go from contact? Well, how do they travel from one source to the next? And then, of course, you have the portal of entry, basically, which is where the organism enters the new host. A new host, again, could be either a human being, a inanimate object, of sorts, okay? Now you also have the susceptible host. Very important for you to note this as well. Susceptible host, this is where the individual must overcome resistance mounted by the host defenses. In other words, what makes this person more susceptible or prone to having this pathogen residing within them? Is it because of their immune system? Is it because they had a break in skin? That's what makes them susceptible to this infection. Okay, that's basically what that's talking about. Now, as healthcare providers, let me not just say healthcare providers, as great, fantabulous, excellent healthcare providers, our goal is to always cut the chain of infection at some point. Remember, we are security guards. Our goal is to make sure we try to cut that pathogen from traveling from one host to another. And we could do that through various means. One of the most common is through effective hand hygiene. Okay, either washing our hands for 20 seconds per CDC protocol, or utilizing what's that thing? PPE is one, but I was saying the other one. Hand sanitizer. I don't know why I lost my words about that one. Okay, and we're gonna talk about what we can and cannot use hand sanitizer against. PPE is another way of cutting the mode of transmission as well. Sterilizing equipment, putting the patient in isolation. All of these are methods in which we can cut the chain of infection. Hence, this is what the scissors is talking about in this diagram. Okay. All right. Now, again, you have the different types of pathogen or infectious agents, which includes the bacteria, most significant and most prevalent in most hospital settings. A lot of hospital settings have the bacterial pathogen, and this is why that the protocol in most healthcare setting is to swab the patient to see if they do have an infection or bacterial infection, especially. Okay, so for example, if they're traveling from one facility to another, the receiving facility, one of the very first things that they're going to do after receiving the patient is swab the patient's nose for MRSA. Okay, they want to make sure that this patient didn't come into this facility with a bug, for example. That's why I say it's the most significant and most prevalent in hospital settings. You have the virus, which is basically the smallest of organisms, fungi, and parasite, and your book goes into more other infectious agents as well. Make sure you know them. Now, this you should be aware of, but the main thing that I will be testing you on is the category of the need for oxygen. You should know about the shape. That I don't really stress too much on testing, but I don't know if it's going to be on your what's that test, benchmark, and then also you should be familiar with categorized by response to gram staining. But definitely, does this bug require oxygen or not to live? You need to know this, because this also, like Anton was saying, is going to determine how we are going to care for the patient. If the bug is an aerobic bug, what does that mean, Shayla? Aerobic. If it needs oxygen to live, what is your treatment going to be?
Don't give it oxygen.
Don't give it oxygen. Suffocate the thing. So you have a wound. And when you you see the patient who has a wound and you did your swab like you're supposed to, and then come to find the lab results tells us that it's an aerobic bug pathogen. Treatment is going to be what? Treatment is going to be what now? Isolate. Are you going to leave it open to air?
No, isolate.
Okay, or cover that wound basically. Okay, you're going to pack that thing up. Okay, right? Because you don't want it to have oxygen. But if it's an anaerobic pathogen, what you going to do?
Let it air.
Let it air out, because we're trying to kill the bug, okay? Or unalive the bug, I guess. I don't know if I can say that word, okay? All right? Now, factors affecting the organism's potential to produce disease. For the upcoming assessment, I will be testing you on this. Number of organisms, virulence, basically how strong it is, competence of the person's immune system. Is the person's immune system even strong enough to fight against this pathogen, okay? And of course, another factor that we need to pay attention to is how long have you been exposed to this pathogen, okay? So those are the different factors you want to pay attention to when it comes to how the patient's been, dealing with this to produce the disease in the first place. Now, you should know this as healthcare providers, as BSN prepared nurses, the identification of infectious agents. Endemic, you already know, is basically localized in a particular region of the world. Pandemic, we already know, everybody in the whole entire world is being affected by this particular pathogen. COVID is one of the common pandemics, okay, that we know. Endemic, for example, could be Ebola, or what's another endemic example? Malaria, etc., okay, because it's to a specific region. Now, yes, you should know the possible reservoirs of where these pathogens could live. I already mentioned them. Other people, animals, food, water, inanimate objects like a table or board, etc. So that's why you have to make sure we always do hand hygiene when it comes to infection control. All right. Portal of exits: respiratory, GI tract, GU tract, breaking the skin. These are all some common portal of exits where the pathogen can escape from and go into a different host. All right, so we need to know this, because once we know this, again, this determines how we are going to provide care. Right? Means of transmission: how is this bug going to travel from one source to another? So you have direct contact. If I directly touch this inanimate object that was filled with pathogens, then of course I am going to also get that. Okay, hoping there's nothing there. And then you have your indirect contact, which is like vector or fomite. I don't know what a vector is. I ain't never heard of that in my life. What's a vector?
It's a bug.
It's a bug that does what? Give me an example of a vector.
It transports
the mosquitoes.
Mosquitoes. Okay. Yes, all right, that's a very good example. Okay, what about fomite? What's fomite now? I ain't never heard of that either.
Isn't that like inanimate objects?
Yes, give me an example.
Like a chair?
Chair, doorknob, table,
Cell phone?
cell phones. Yeah, you know, people like to be in their cell phones while they're using the bathroom. So, hey, it is what it is, okay?
Carlos is there.
Yeah.
Oh, Lord.
Dirty.
Then you have, thank you. Then you also have another means: droplet versus airborne. Ooh, what is that, Cornelius? I ain't never heard of these before in my life. Droplet and airborne. Cornelius like, I ain't never heard of it.
Droplet's probably like a respiratory droplet, like somebody sneezes and it's carried by like that saliva. Versus
Okay.
Airborne, like it's in the air, like
You breathe it out.
yeah,
coughs.
it's like just inhaled.
All right. While Trinity try to fact check your information, your response, Jackie, what else? Trinity's like, huh? What do you mean?
Like
Fact
spit?
check. What up, Jackie?
Like droplet, I was thinking like spit or like coughing, like literal droplets.
Oh.
Going on.
Okay.
It says the difference is size.
Well, say it again, Cornelius.
It says that the difference is size.
That's the difference. Tell me now. What's the difference?
Droplet is, or airborne is smaller than 5 micrometers, and a droplet is greater than 5 micrometers.
What does that mean? What does that mean? If it's a difference in size, tell me, what does it mean?
Can travel faster.
Huh?
It's not-
That's what it means?
No, I'm just saying stuff.
Y'all know the essence is right in front of y'all. Anton, before I get to Trinity.
They have different prevention strategies based on the size.
Anton,
Fine.
Anton, say it louder, please.
They have different prevention strategies based on the size.
They have different prevention strategies based on the size. Before Trinity facts checks what you're about to say, please tell me and explain what you mean by that.
If it's smaller than 5, then you would have a different system to prevent it rather than something larger.
So if it's small, what is that? If it's smaller than 5, what is it called? What does the book say it's called?
Airborne.
Smaller than 5. What is it, microgram or something like that? Microns. Okay. And then this one is greater than 5.
Yeah.
And what's the strategy? Treatment strategy for the airborne. Trinity?
For prevention,
Yes.
for airborne, like well ventilated spaces, negative pressure.
Just put negative pressure. All right. Anything else? Anything else for airborne?
Respirator.
Do you know the name of the respirator? The common name?
N95.
And then droplet?
And what?
Well, all these gonna have hand washing. All of these, you're gonna wash your hands.
PPE.
Huh? Maybe?
No, say maybe.
Oh.
What does the book say? Oh, you see, TikTok.
I'm taking notes.
Help me out because the answer's right there in front of them, and they still try to guess.
Because the book has a bunch of word salad.
It's
Just tell me the.
It says
answer
social
right there, bro.
distancing,
Why do I read two
Disinfecting.
paragraphs of
disinfection
nonsense?
of high touch areas.
which one? Droplet?
Yeah.
Okay,
Cloth
disinfection. Yeah. Okay, disinfection. Yeah. What else?
Yeah, cloth mask.
This is what I want. Cloth mask. Cloth mat. The one that.
The little face guard things.
Okay.
What you can make out of shirts.
Well, yeah, when time's called for it, yes. Okay, anything else? Anything else?
Hand wash.
Every one of these is hand washing.
Frequent hand washing.
Don't play with me.
It says social distancing, the 6 feet apart.
All of these require some form of PPE. Let me, guys, yeah, don't think PPE is just limited to droplet or just limited to airborne. What does PPE stand for again?
Personal protective.
And it involves what? Let's go with PPE.
Gloves.
Gloves, mask, gown, goggles. Does every last one of them require a goggle? Does every one of these require you to wear goggles? No, it depends on the pathogen. It also depends on what you're dealing with. If you suspect that you're going to have bodily fluids and you suspect that the bodily fluids could potentially splash your eyes, you're definitely wearing goggles, okay, or eye protectors, okay? Does every last one of them require you to wear a mask?
No.
Okay, you see? Let's not listen. For the use of NCLEX, not the real world, okay? Does every last one of them require you to wear a mask? No. Mask, the surgical mask, for example, droplet. Now, if you have somebody who's in simply just like contact, okay, like C. diff, we're wearing a mask for a different reason, okay? We're wearing a mask for a different reason, but not to protect the patient or ourselves. Does that make sense? Okay? I want you to make sure you know this so you don't come trip on me on the exam. Are we cool? So every pathogen requires some form of PPE. What you wear in terms of PPE depends on, number one, the pathogen that you're dealing with, and if you suspect that you're going to come into contact with bodily fluids. We cool? All right, pretty good. We cool. All right.
So you're saying don't show up in someone's room that has the flu wearing full body PPE?
In the US of NCLEX, no. Is it done in the real world? Yes. Okay. Yes, it is done. Okay.
Especially I see the
Hello.
whole CDC.
Okay. So you do need to know the means of transmission again, because that's going to tell us how we are going to protect the patient and ourselves. Okay. Now, you do also need to know, especially for the next upcoming assessment, the stages of infection. All right, I believe this one is different from the PowerPoint, but please read the book. The incubation period is this is when the organisms are growing and multiplying, and the prodromal stage. Can somebody confirm if this is the same as what it is in the book? I think one of these is different. I want to say prodromal versus full.
It's the same.
It's the same?
They're all the same.
All right. Prodromal stage is where it's the most infectious, for sure. All right? So if it's the most infectious, are we just watching this patient and be like, you good because you have no signs and symptoms? What's our concern as registered nurses once we know that the patient is in the prodromal stage?
Them infecting others.
Huh?
Them infecting others.
They're going to infect others, yes, okay, because again, this is where they're the most infectious, but we won't be able to tell that because, again, usually they don't have any signs and symptoms at this time, okay? They may or they may not have signs and symptoms, because the signs and symptoms could be vague. And sometimes it could be simply as something as just malaise, I feel tired. Yes.
The book says for the prodromal that early signs and symptoms of disease are present.
Say it again.
It says that the prodromal stage, the early signs and symptoms are present.
Okay, that's what I thought.
Vague and non-specific.
But it's vague though, right? Does the book say it's still vague?
So I just read that.
Yes. Read it again, what it says in the book.
Early signs and symptoms of the disease are present, but these are often vague and non-specific.
Yes. So you see,
Okay.
yeah, so this is like your malaise, you feel tired, you don't know if the patient is actually sick or not, or they're not sick, okay? And then you have the full stage. This is where they show specific signs and symptoms of the disease, all right? Now, I know that it says stages of infection. This is where I want to make some clarification here. Notice that it says after the full stage of illness, what's next is convalescence. Convalescence is what? Recovery from the infection. Now, I need you to know after the full stage, it can go either way. When I say either way, the patient may either convalesce or they may end up going 6 feet under. Not everyone goes into convalescent period. Does that make sense? And I know the book is not that clear on this.
Yeah, it also says permanent change in their physical.
Convalescence?
Yeah.
It says permanent change?
Yeah, it can either go either way. It could be like you can get healed or you will be healthy, but there will be like permanent change.
Yes. Okay? So I need, because again, you may not get well and you may end up,
Jesus.
Exactly. All right? So I just want to make that clarification. We're all hoping that the patient, goes into convalescent period. That's what we would like to see for the most part, but not all patients go into the convalescent period. All right? Now, you do need to know inflammatory response. Again, this is basic science where the patient with inflammation, this is part of the healing process. Just know that it does occur in response to the infection or an injury. So if you got what was Alexandra's patient earlier? Trauma, the bone, all right, was exposed. You might see infection, okay? That's response and infection. Inflammation, all right? That's the body's response to that exposed injury. Just note that with regards to the inflammatory response, it can be acute and it also can be chronic. In other words, they may be dealing with this for an extended period of time. Know the different phases just for the next exam. Vascular versus cellular stages, where vascular means there's vasodilation, you see the redness, the heat. This is where you can see some allergic reaction because of the histamine production. They may have swelling. They may also have loss of function of that particular body part as well. All of that takes place in the vascular phase. In the cellular phase, this is where you see the white count starts to get elevated. And this is where we are closely monitoring the client as well because, the body's trying to get rid of this pathogen. And one of the mechanisms in which it does get rid of it is by the increased leukocytes and neutrophils just to clean up that pathogen and get rid of it. And then you see that at this point during the cellular stage, the cells that were once damaged, this is where they're starting to be repaired as well, okay? Now, when it comes to responding, the response of the immune system, you see that the body's always trying to protect itself. Just remember, Dr. Sullivan, the body's always trying to what? Not die, okay? Right? So one of the things that it does, of course, in the immune system, you have the humoral immunity. Please, you do need to know this for good, is your antigen versus antibody. I don't want you to know this just for the test. And I don't want you to know this information only for NCLEX either. You do need to know this as responsible healthcare providers as well. Humoral immunity is concerned with antigen and antibody. Antigen is a foreign material, which can be, for example, bacteria. It could be a virus or anything. Those pathogens that we talked about, that's antigen, is outside of the body, foreign. Antibody now is where it's produced by the body in response to the antigen. Okay, again, because you got this foreign material coming in, now the body starts to produce antibodies. All right, and we're going to talk about this again, especially when we do blood transfusions later on. All right, and then you have cell-mediated immunity, where there's an increase in lymphocytes that destroys the pathogens, or it reacts to with cells that the body can recognize as either as harmful. And sometimes with cell-mediated immunity, this is where you also see autoimmune disease also start to take place too, where the body looks at itself as a danger, which is even more dangerous. Now, yes, you do need to know the risk factors of infection: non-intact skin, abnormal pH level, elevated white count. Now, I can understand. While I can understand, elevated abnormal pH, elevated white count, fatigue, yada yada, stress, indwelling catheters or devices. But what does gender have to do with a risk factor for infection? That part I don't get. Yes, Cornelius.
Pregnancy, menstrual cycles.
Lil, talk to me a little bit about more. Pass that down. Pass that. Okay, pass it. Anton's like, I'm not passing down the sticker box. It's for me. Oh, why pregnancy?
Because it lowers the body's immune. Like, you basically lower your body's immunity.
Mm-hmm. And why menstrual cycle?
Well, doesn't it make women more susceptible because they're like constantly bleeding, so their body's having to reproduce red blood cells more often?
Okay, that's a factor. Yes, Anton?
UTIs.
What about UTIs?
Females more common than males
Do you know why?
because you're doing the wrong way.
You doing what the wrong way?
You're walking the wrong way.
Okay.
That's my best. Right now.
I mean, okay, that is actually a risk factor. Kenoshia?
Guys' urethras.
Huh?
Guys' urethras are longer.
Yes. Okay, it's the anatomy too. That's one of the major reasons. Yes. Okay. Kiani?
No, I was just gonna say, during the menstrual cycle, because of like, when you have like a pad on or a tampon, you can get like, a tampon can, if it stays in too long, you can get infection because of that.
Yep.
Because of the pad, you can get, because of the moisture, you can get like, I've seen girls get like bacterial infections.
Mm-hmm.
You have tight pants, if you wear cotton underwear, you can get, other infection. It's like, there's so many things you can get because of just clothes or devices you have to use or whatever.
Okay.
It's hard. They
They don't have to deal with all that. Okay, I hear that, Trinity.
The X chromosome holds more immunity than the Y. So like XX for women.
Ooh, X chromosome. Say it again.
Holds more innate immunity than the
So
Y.
who's XX?
Women.
Women. XY.
Men.
Men. Okay, I'm just making sure. Okay. So it's at the chromosome. She took it down to the nitty gritty. Okay, I see you. But also with regards to the menstrual cycle, our pH balances does change. Have a tendency to change, which also predisposes us to infection, or those with a menstrual cycle to infection. Okay, hence the gender. All right. Now, stress. How in the world does stress predispose an individual to infection? Okay, Trinity and then Chanel.
It's a steroid. Steroids suppress the immune system.
Okay, that's one. So that's medication. Okay, the cortisol. Okay.
Yeah, I was gonna say stress weakens the immune system.
Okay. All right. Y'all like to say nursing school puts y'all in stress. Stresses y'all out. Is your immune system weakened because you're in nursing school?
Yes.
Bruh.
It's not because of the lack of sleep.
The lack of sleep, the constant, like the
No, we're allergies for some reason.
May not
They're
be
allergies.
all
No
the
eating,
same.
no sleep.
Okay.
And then you have outside factors also contributing on top of just school. Some people have kids, some people have work, some people have no.
What does the book say is the reason why stress is a risk factor for infection?
Lower your ability to fight infection.
Wait, can you hear me? What he's looking for?
What does the book say is a reason why stress is a risk factor for infection?
It affects the body's normal defense mechanism.
Yeah, it just says
Huh?
It affects the body's defense mechanism.
It affects the body. That's all it says?
Adversely affect the body's normal defense.
That's all it says?
It's the
What page y'all on?
670.
670.
6'7". Okay, yeah. Stress. That's it. Okay. That's what the book says. That it does affect the immune system, but what I want to elaborate is stress in and of itself is not always a bad thing that automatically predisposes you to infection. Okay? It's when you have it at when you're exposed to that stressor or stress for an extended period of time, like months and weeks.
Distress.
Yes.
You stress.
You mean like 16 months?
Damn, okay.
Okay. Not here throwing shade. Okay. But yes, for an extended period of time, that's when you and of course, yes, your immune system is going to be is at risk for being suppressed. That's what predisposes you for infection. But if I'm stressed out because, for 10 minutes, that doesn't mean I'm automatically exposed to infection. Does that make sense? Okay, so it's the length of time that you are exposed to that stressor or the stress in and of itself. That's when it becomes a problem, predisposing you for infection, suppressing your immune system. Now, of course, we already know use of indwelling or invasive medical devices. Okay, this is why we try as much as possible to avoid using medical devices as much as possible, like Foley catheter. Yes, your bladder, you're retaining fluid in your bladder. Let's see what we could do to avoid using the Foley catheter. Let's see if we could just, we pour some water or something, and get you up and moving. If it's no contraindication, yes, we'll try our best as much as possible. If the patient does have an indwelling catheter, such as a Foley catheter, we are assessing every single day the need to remove that catheter. Do they meet the criteria to have that catheter or that indwelling device removed? Because we know the longer that device is implanted within the client, the more likely they are to be at risk for infection. Hence why we have to date our devices. Does that make sense? Are we cool? Okay, very good, very good, very good. Now, of course, we are you see? Numbers. Numbers. Do not play with me and my numbers. All boxes. You've been warned. Now, of course, you see on a board that the normal white count is from 5 to 10. Yeah, it's wrong. What you mean it's wrong? Don't play with me, Carlos. Okay?
You can write it every week.
Okay. 5 to 10. Now, what does it mean? Let me make sure your book goes into it.
yeah, just go back to the book.
No. If your book says what it means,
Those differences.
when I want you to know what it means when your white count is above 10.
It means you got infection.
It means what?
Infection.
Okay, if it's 11, you have an infection. But what if it's 3?
Then
The infection
you have like leukemia probably.
Huh?
You gotta look at the differential ones.
Look at you jumping into med sir. Look at you gotta go into the differential. Okay. See, now I can test that. I can test that. Look at her. See, now I can put different. What does differential mean?
Break it down. Break the white blood cells down.
Huh?
You have to break the white blood.
You have to break the white blood. You see? So now I can put that on the next test.
No.
No. Don't do that. Don't do that.
It's okay.
Very good. But I just want you to know now, you do need to know the white counts for sure. I ain't gonna put the differential stuff, okay? I'm playing with you. I'm tempted to, but no. All right? What does it mean when your white count is elevated? And what does it mean when your white count is below the norm? Like are you concerned when a person's white count is 1,000 millimeter per square millimeter or whatever this M3 is? Yeah?
Yeah.
All right. Why? Chanel, why are you concerned?
Possible signs of cancer.
Ooh, what else?
Also,
No. Help Chanel out. Rihanna, raise her hand. I gotta bask in this moment. What does it mean?
Viral infection.
Huh? It could be okay. It could be another type of infection. She said it could be maybe a viral infection. So now it's going to probe you to look for other information as to what is actually going on with this client. Okay? That's all I'm gonna need you to know at this level. Now, of course, Kenosha, I could put on her test, what other data you're going to be looking at, like differentials and stuff like that, okay? Now, when elevated, you're also looking at elevated ESRs or erythrocyte sedimentation rates, okay? That can also indicate infection. You are also collecting other bodily fluid body samples, okay? Like urine, blood, sputum, or draining cultures, which we had already, which you already know how to do. So, for example, when they have a Foley catheter, most facilities would want a urine sample just to make sure. But if you're looking at the characteristics of the urine, which we'll talk about more in depth when we get to GU, that's going to probe you when the urine is not clear and it's cloudy. You may want to collect a urine sample just to see if there's any infection going on, okay? You're may do what's called a urine and culture and sensitivity. Urine, culture, and sensitivity, or urine CNS. Okay, what you call for short. Same thing for blood. Now, to go back to what Anton was saying earlier in terms of our treatment method, why we need to know what type of pathogen we are dealing with. When we suspect that a patient has an infection of sort, we are not just going to go and prescribe an antibiotic. We're not just going to go say, give amoxicillin. No, we already identified that. However, let's say the physician does order an antimicrobial source. Let's say Anton gets a patient and the doctor orders penicillin, okay? Before Anton administers the first dose of penicillin, Anton, what would you do first? What do you think you would do first? Before you administer the first dose of penicillin, the doctor ordered, because they suspect something, the doctor suspects something.
Take a lab test to get a baseline of where they're at before the antibiotic.
Good. Do you know what lab tests you would be collecting?
Blood test with the white blood cells, or?
Okay, you close. Yes, culture. You always collect a culture of that body sample, whether it be blood cultures, urine cultures, sputum culture, wound culture. You will always collect a sample of that bodily fluid prior to starting any antimicrobial. Okay? Because if we do just go ahead and administer that antimicrobial as is, just because the doctor suspects something based on other diagnostic reports, maybe they did a CAT scan and they saw the patient has pneumonia or whatever, okay, or something like that. Well, we would just collect a sample of the bodily fluid, and then we send it off, of course, for facility protocol, and then we start the antimicrobial. Just so you know, you don't need to, I'm gonna give it to y'all anyway, yeah. Just so you know, usually patients are started off on a broad spectrum antimicrobial, such as Levaquin, for example. Levaquin is the one that comes to the top of my head, but there's many more, okay? Before they start. But anyway, before you start any antimicrobial, collect that sample first. Are we clear? Because then the lab report will tell you in detail what that pathogen is sensitive to and what that pathogen is resistant to. If the pathogen is resistant to Levaquin, and you go give Levaquin, what you gonna do with that order? What would you do with that order?
Tell the physician,
And why?
because it's not gonna work.
Exactly. So you want to change it to what the pathogen is sensitive to. Does that make sense? Carlos, you raising your hand, you stretching.
Well, what do we do when there's like a super resistant one?
Oh, sister,
Like
the treatment becomes more. So first of all, it's identified through cultures.
Yeah.
Number one, they're just going to get a stronger antimicrobial.
Aren't there like 3 like super penicillins that they use in case of those situations?
Right. So again, it depends on the culture sample. They will do that. Yes, like Rosefin is one of them. Yeah, it's strong.
Yeah.
Ceftriaxone and yeah, all that stuff. Hopefully you don't want to, but when you get to med surg and farm, you'll know why we try to avoid it. But if push comes to shove, not avoid it, but that's not going to be your first drug of choice. But anywho, moving forward. So we collect our information, and this is part of your data collection, your nursing process, your assessment. Okay? Hello? So play with me. Okay? All right. And then now, of course, after we've collected our information, we come up with analysis, okay, and then we plan and implement, okay. So again, your plan and implementation, it depends on the data that you have collected. Of course, demonstrate effective hand hygiene. You want the patient to be able to demonstrate effective hand hygiene. Identify signs of infection. Maintain adequate nutritional intake. Now, let me talk to y'all for a little bit with regards to nutrients. Okay? What nutrient could possibly be important when it comes to infection control or building the immune system?
Protein.
What did you say?
Protein.
I wasn't expecting that, but I'm happy you said that. Yes. Protein is one. What else? Zinc. Anything else? Nutrient is important with regards to infection control.
Vitamin C.
Vitamin C, yeah.
Vitamin D is actually important. Not many people know that. Vitamin C, vitamin D, you got collagen, okay, etc. Make sure you know the nutrients that are responsible or that helps with proper infection control. Okay, that helps build the immune system. Now, in your test question, they might say, you may ask, how do you know the patient has this type of infection or whatever? What's an appropriate food choice? What would you encourage? Omega-3. Omega-3? For the heart?
Yeah.
You know what? I'm gonna put that on the test question. Omega-3. What's the source of omega-3? Salmon, fish, or whatever? Yeah. Well, fish. And they gonna be like, Professor, what happened was, I'm be like,
Some noodles.
Give me, what would be appropriate nutrient? Food choices. Steak for immune system.
For protein.
For infection control.
Like fruits.
In building
I just heard like
immune system. Okay, say it again.
Fruits.
Yes, Anton.
Yeah, I was gonna say that because they kill the free radicals and stuff.
Berries.
Yes.
Berries.
Berries, fruits. Y'all don't play with me. Y'all better know this, okay? Demonstrate proper disposal of soiled articles. Now, for test purposes, as I know in the real world, you're gonna see different things. When it comes to soiled articles, when you're changing the linen, for example, you are not supposed to put the soiled linen on the floor. It's supposed to go where? In the hamper. I know in the real world, depending on the setting, depending on the need, okay, and remember, safety and infection control is part of safety. Your priority may be, let me try to get this patient to breathe. Okay, so then you're gonna see soiled hampers, linen, soiled hampers, soiled linen. You may see soiled linen on the floor. Okay, especially when we're trying to deal with airway, breathing, and circulation. But when everything else is all said and good, the physiologic needs are all met. Okay, and then we go up to the next level of Maslow's hierarchy of needs, safety. Now, of course, in terms of safety control, infection control rather, it's very important that we make sure to put the soiled linen in the hamper. Okay, when there's no physiological issues that is of concern. Of course, use the appropriate cleansing and the disinfecting techniques, because in the facility you'll see different types of wipes which are specific for particular pathogens, like the purple wipes, and you have the orange wipes, and you also have bleach too that kills particular pathogens. You got to just read the container and it'll tell you, okay, this container is good for these types of pathogens. Okay, and of course, proper immunization and stress reducing techniques, because once you are exposed to stress for an extended period of time, that can minimize your immune system. Now, this right here, you definitely are not gonna play with me. Okay? Asepsis. First of all, asepsis is basically where we try to prevent infection or break the chain of infection. We're trying to protect the patient from bugs as much as possible. That's asepsis. And make sure you know anything means without or very little. Okay? And then sepsis, infection, without infection. All right? There are two types of aseptic technique. Two types of aseptic technique that you must be very familiar with. And this is not just to pass my exams or NCLEX. This is also so that you are providing quality care of the patients, for the patients. You have medical asepsis. This is simply where you perform hand hygiene, you wear your gloves, you try to reduce, of course, the number of pathogens as best as possible, keeping the area clean, making sure you don't shake the linen on top of the patient, those kind of activities, right? That's just simple medical asepsis, in addition to other things mentioned in your book, okay? Surgical asepsis, in addition to medical asepsis, now we're going very hard. We're going to do sterile technique. Okay? This is where we're making sure we get rid of bugs for sure. Okay? So, again, I want to emphasize that surgical asepsis is in addition to medical asepsis. Because you still going to wash your hands before you don on that sterile glove, correct?
Yes.
Correct?
Correct.
Don't play with me.
Won't play with you.
Okay, all right? So, for example, when we do the indwelling urinary catheter, do we not perform perineal care? All right, you learned that. Okay, so and on top of perineal care, once we get to that step, then we're going to further sterilize with the betadine or the CHG and all that stuff, just to make sure we got rid of the bugs as much as possible. Okay? No bugs should be living. Okay? Are we clear on that? Does surgical asepsis negate medical asepsis? Now, hand hygiene, 5 moments. Oh, you should know this. Yeah. When do you perform hand hygiene? Before you go touching the patient? Before you clean? Before you do a clean procedure? After you've been exposed to bodily fluid? After you touch the patient? Or after you've been around the patient's surrounding, the patient and their surrounding, touching them? These are some of the main moments in which you perform hand hygiene. Before and after touching the patient, okay? Now, with regards to bacterial flora, you must know that there's 2 main types. There's transient, which is basically loosely attached to the skin, and you can easily remove those types of those types of pathogens, okay? And then you have resident bacterial flora, which basically is found in the creases of the skin, so this will require a little bit more friction, a little bit more rubbing. just to remove the debris or the bacteria. Okay, those are the two main types of bacterial flora. You should know that, especially for the upcoming assessment. You see this right here? Don't play with me. Okay.
So would resident be like a yeast infection?
Yes.
In somebody's obese person's folds?
Yes, in the folds. Okay, that's a good example. Yes. Okay, because you got to do a little more than just, simply wipe. Okay, very good. Now, in the healthcare facility, you would think when a person is admitted to the hospital, for example, that their chances of being sick or more sick are very low. That is not the case. In reality, their chances, especially if there's negligence on the part of the healthcare provider, like nurses or physicians, for example, their chances of being more sick or being infected are higher. Now, we have to do our best to reduce what's called hospital-acquired infection or hospital or healthcare-associated infection, or another word is nosocomial infection. Okay? You have 7 main types, and there's probably even more now. Okay? But for the sake of the upcoming exams, the 7 main types of hospital-acquired infection, or the other term is nosocomial. You have CAUTI, which is catheter-associated UTI, because you got that infection through a Foley catheter. SSI, surgical site infection. This is why a lot of times they do timeout. When they're doing their timeout or when they're doing their cleansing their area, they make sure they use the appropriate solution, not just in timeout. You have CLABSI, central line. So for example, like your PICC line, your UDOG catheter, your 8 line, your femoral, etc. Those are your central line associated bloodstream infection. That's a very high risk of infection. This one right here. Very common. You got your MRSA and C. diff. Now, MRSA stands for methicillin-resistant Staph aureus. What does that mean? Stacy, methicillin resistant.
Me too.
Stacy.
Like a MRSA?
What does that mean?
Something bad.
Yeah, pretty much. But look at the name. I want you to look at the name. Methicillin resistant Staph aureus. In the first 2 words alone, what does that tell you?
That's contagious.
It can be, but in the word, these 2 words. Let's stick to these 2 words. Resistant to what?
Methicillin.
Okay, methicillin. Do you know what methicillin is? No?
Awesome.
It's not insulin. Oh, I thought you said insulin. Oh, okay. I thought you said insulin. I was like, no, it's not insulin. Okay, yes. So that means that this bug is resistant to methicillin. It's an antimicrobial, right? That they usually give to fight off infections, right? But if this bug is methicillin resistant and you have a order from the physician to give methicillin, what you gonna do with that order? Call them up, because this ain't gonna work. You understand? So you may want to give another antimicrobial, again, depending on the culture results, something that the drug is sensitive to, like maybe vancomycin or something like that, or something. Okay, something else. All right? You see that? Methicillin resistant. I need you to capture the essence of what I'm trying to tell you.
I got it.
Okay? If it's resistant to that bug, to that antimicrobial, we can't use it to treat the infection.
I just had a question. Like, since you were saying it's nosocomial, like for our future tests, are we gonna get tested on like between nosocomial and iatrogenic?
Oh yeah.
Because The question with the catheter one was that it was saying it was iatrogenic instead of nosocomial since it's directly from.
What does iatrogenic mean?
It's also in the hospital, but it's directly from a procedure.
Procedure related. Yes.
So wouldn't that count as?
Not. Oh well. Well, yeah, I see what you're saying. So, Cardi, for example, the procedure was inserting a Foley catheter. It could be iatrogenic, yes. But HAIs, nosocomial, is not limited to just that. For example, pneumonia could be as a nosocomial. MRSA could be nosocomial because maybe they didn't do they didn't catch that they didn't do the swab. For example, they didn't swab that wound and then didn't find out till later that the patient has MRSA, for example. Okay, but yeah, I see what you mean. So yes, if it's but for testing purposes, it has to say in the scenario that the procedure was done.
Okay.
Okay, good question. All right. Now, there's others like VRE. Anybody familiar with VRE?
Resistant antibiotic.
Okay, so what does that mean?
It was resistant to vancomycin.
So if I get an order for vancomycin for a bug that is VRE, what we doing again? I just want to make sure, because I want y'all tripping and be like, I ain't never heard of this drug before. And I'm going to be like, but you do know what MRSA is. Right? Right? You do know what MRSA is. Now, I'm not going to put on a test VRE and not put what it stands for. You understand what I'm saying?
Yeah.
But if I see on a test, the patient has been identified to have vancomycin resistant. You know what I mean? What you gonna do with that? You're not going to treat it with vancomycin.
Yeah.
Right? If they have MRSA, we're not going to treat it with
Vancomycin.
no. If they have MRSA, we're not going to treat it with methicillin. Okay? All right. C. diff. Now, this is one that you cannot use hand sanitizer on. Say it louder, please.
You have to wash your hands.
I don't think Macheska heard you.
And you have to wash your hands. And I would double glove when you're in that.
Now that's being extra. Okay? Now that's being extra, but yes, okay? You must wash your hands. In your book, it does tell you that. You have to wash your hands. You cannot use antimicrobial hand sanitizer for C. diff. Okay? All right. Now, these are some other ones. It's a multi-drug resistant organism. You got crab. And yes, crab is one. I don't know. I forgot what the CR stands for. But you got vancomycin, VRE, CDI, etc. Okay? Now, factors determining how we're going to sterilize. And equipment, for example, it all depends on the number of organisms present. Again, this is determined based on the culture that is done, the number of organisms, the nature and the number of organisms present, the type of equipment, what are we using this equipment for, and what forms of sterilization and disinfection that there is available, and of course, the timing as well. Okay, so these are all factors that determines how an equipment, for example, is going to be sterilized, right? Now, PPEs, we already talked about those different types of PPEs. Make sure you remember how to don on and don off or doff, remove and place your PPEs. I know your checklist, the skills checklist give you one version. I'm testing you by what's in the book, okay? In terms of removing the PPE, go by what's in the book. Study what's in the book. Don't go by the checklist. Go by what's in the book, all right? In terms of putting on and putting off your PPE. Yes, you will be tested the order of removal and the order of putting it on, all right? Now, isolation precautions or precautions. You must know the different types of precautions that are used in terms of infection control. For standard precaution, you got to know everybody, no matter what you got, what you don't got, what you're in for, everybody is going to get standard precaution. Okay? Standard precaution, this applies to blood or bodily fluid or secretions with and excretions except sweat, whether or not blood is present or visible. And then of course you use standard precautions in non-intact skin and mucous membrane. This is where you perform your hand hygiene. This is where you apply the appropriate PPE. And yes, gloves is just an appropriate PPE. Is a PPE, I should say. Right? We already identified that. Now, Kenosha, I want you to tell me in the book, according to the book, when should I, as a healthcare provider, use gloves? Alexandria, while Kenosha is going to validate your information, your response, give me what you think. When should I use gloves?
Like any kind of procedure, like so if you're going to put an IV, like if you were gonna give them a bath, like a bed bath, I would say. Like almost everything, but you don't have to put gloves on. Like if you come in the room, you do hand hygiene, and you're just there like kind of checking on them. Like you're allowed to like touch them. Like,
Will you wear hands?
Yeah, like feeding, you can do that without gloves.
Huh?
It says feeding, you can do without gloves.
No, it says you have to.
I'm not touching anyone.